Hello all. Myself, Dr. Ajinkya Pawar, Medical Officer and Hospital Accreditation Coordinator working at National Institute of Naturopathy, Pune. On behalf of our Director, Professor Dr. K. Satyalakshmi, and from our entire NIN's faculty, I welcome you all on the 10th day of informative webathon on Insights of Gandhian Perspective on Health, organized by National Institute of Naturopathy, Pune, in association with Regional Outreach Bureau, Maharashtra and Goa. We all know naturopathy is a distant system of drugless medicine, recognized by World Health Organization and is defined by its patient-centric approach rather than the treating the symptom, which is used by modern practitioners. Worldwide, over 98 countries have practicing naturopaths, representing 36% of all the countries and every world region. The first International Congress on Naturopathic Medicine happened in Paris in July 2012, which was organized by key members of Tabitha Parker and Jonathan Wardle, and many naturopathic communities, in particular, American Association of Naturopathic Physicians and Global Health Committees, which was chaired by Tabitha Parker and Michelle Cronin, and other ICNM executives, which played a major role by meeting with naturopaths and collaborating with other world federations of naturopathy to spread the awareness of naturopathy globally. So today is a chance to explore and understand the role and potentials of naturopathy of globally. So today is a chance to explore and understand the role and potentials of naturopathy in global public health. So to begin with today's program, first we will hear Gandhi Bhajan. The lyrics of bhajans are Mat Kar To Abhiman Re Bande, sung by Makarand Masram, Regional Outreach Bureau, Pune. So let's begin the session with Gandhi Bhajan.
मत कर तू अभिमान रे बंदे, झूठी तेरी शान रे, मत कर तू अभिमान, मत कर तू अभिमान रे बंदे, झूठी तेरी शान रे, मत कर तू अभिमान। तेरे जैसे लाखों आए, लाखों किस्मती खाए, तेरे जैसे लाखों आए, लाखों किस्मती खाए, रहा नाम निशान रे बंदे, मत कर तू अभिमान, मत कर तू अभिमान रे बंदे, झूठी तेरी शान रे, मत कर तू अभिमान। झूठी माया, झूठी माया, वो तेरा छुपन जाया, झूठी जो नहीं पाया वो तेरा जो हरि जाया जपने हरि मत कर तू अभिमान मत कर तू अभिमान झूठी तेरी शान रे मत कर तू अभिमान मत कर तू झूठी तेरी शान रे मत कर तू अभिमान मत कर तू अभिमान मत कर तू अभिमान
Was a great music for pleasuring the mind. As Gandhiji used to say, prayer is food for soul and mind. And when the mind is full of prayerful thoughts, everything in the world seems good and agreeable. Prayer is essential for progress in life. We thank you, Regional Outreach Bureau, for arranging such a beautiful composition. Moving on to the next session of Gandhi Katha, where today our director, Professor Dr. K. Satyalakshmi, will narrate the story on Gandhi's insight on health.
Namaste. Welcome to Gandhi Katha. Today we will see how Mahatma Gandhi treated his son, his second son, Manilal, who had both pneumonia as well as typhoid. And Mahatma Gandhi also knew that this Manilal already had an acute attack of smallpox some years back. So, in this background, the boy was not having any amount of strength left. He's continuously having fever for a long period. But Mahatma Gandhi was in favor of giving him hip baths and Kune's hydrotherapy treatments. But that too very short period of time, that is only for 3 minutes, he would take the boy and then keep him in cold tub for 3 minutes and then give him orange juice mixed with water. So like this for 3 days 4 days he was giving, but then the temperature did not come down, it persisted. At this time, Mahatma Gandhi did not know what to do. So he read his books again, the Nature Cure books, and he started thinking that he should be given full bed sheet pack. And immediately he got all the bed sheets wet and put him in full wet sheet pack and sat along with the boy. And after one full night, he went on giving this full bedsheet pack covered with two blankets. The whole body was burning like a hot iron and completely parched. But by next morning, the Manilal's temperature started coming down. He had profuse sweating after this full bedsheet pack treatment, and after that, with the diluted milk and fruit juices, in another 30 to 40 days' time, the boy completely cured of all fevers without any injections or the advice that was given by the conventional doctors at that time was chicken soup and some amount of wine or brandy. Without any of this simple nature cure treatments, Manilal became completely all right. So, this is the story for the day.
Explanation on Gandhi's view on health and his experiments towards living a healthy lifestyle and adopting it along with the family members. Thank you so much, ma'am. So going further with of understanding of health and Gandhiji's view, going further with understanding of NIN's activity, it's my immense pleasure to introduce about National Institute of Naturopathy activity in the field of man building in naturopathy and providing standardized quality care for patients. Since 2002, NIN had conducted naturopathy and yoga therapy paramedical training courses for more than 1,000 aspirants in naturopathy field, where the mission was to create a man building in the field of providing uniform and standardized nursing care throughout India to make naturopathy and yoga therapy as a primary level nursing care teaching model. At present, there are a number of training programs had been conducted for students, disabled persons like blind, community health workers like ASHA and Anganwadi workers. In fact, in 2018, NIN was nominated and received one of the prestigious awards for providing such training for community health workers. Currently, there are more than 5,000 NIN certified paramedical students are providing naturopathy and yoga therapy nursing care nationally and internationally at various naturopathy hospitals and wellness centers. In addition to it, in 2018, National Institute of Naturopathy became a first naturopathy hospital accredited by National Accreditation Board of Hospital, Quality Council of India under naturopathy sections of hospitals and clinic. And NIN set a role model in providing standardized and nursing care for patients. Now, moving on further, let's hear something on importance of vitality on health, where Dr. Kajal will brief us on vitality.
Good morning, all. As we all know, the theme of this year Naturopathy Day celebration is nurturing vitality through naturopathy. So today, I'm here to talk about addictions and how addictive substances have impact on life energy. Addiction is a condition that is the result when you use any substance or engage yourself in any activity that gives you pleasure or that gives you happiness. Your intake becomes compulsion and it starts interfering with your daily responsibilities and daily activities. And it also hampers your work style, your lifestyle, as well as your health. Addictive substances or any highly intense activity triggers the release of hormone called as dopamine. That particular hormone is one of the body's reward system. It makes you feel good. Thus, the brain will register that particular substance or activity as important and it will take it as a reward experience. In one of his talk, the John Harry said, addiction is just an adaptation. It is not you. It's the cage where you live in. Addiction can be of anything. It can be of substance, behavior, gambling, eating disorder, gaming, spiritual obsessions, shopping, internet, anything. But now the question is, are we addictive to something? Do we have a habit of occasional indulgence? Do we have a habit of any substance like tobacco, alcohol, caffeine, anything? If yes, what is the severity? Is it mild? Is it severe? Are we okay if we are not having it or if we are not doing it? Are we able to cope up with the daily activities? So, when we talk about the effect of these substances on health, they does not have any positive effect. So body has to overcome the effects of these addictions, even though they have so many positive or they have so many reward experiences, but it uses the vital energy of the body. In a long term, this tends to limit life in many ways. In other words, we have to be beware of many activities, behaviors, or habits that are lowering the vitality of the body. And we need to overcome them if we want to have long, healthy, and happy life. So I'll end my discussion about addictions here. So tomorrow we will be talking about physical activity and vitality. So please stay tuned with us. Thank you.
For enlightening us, thank you so much, Dr. Kajal, for enlightening us on the importance of vitality on health. Now let's move on to the main element of the webinar to understand the role and potentials of naturopathy in global public health. India has been a hub of knowledge of alternative medicine system. It is estimated that Ayush is already a worth of $1 billion market. and is expected to grow to further thanks to increasing global awareness about alternative medicine. Naturopathy, a prominent component of drugless system, has itself gained significant ground over the past few years globally, particularly with the rise of non-communicable and chronic disease that modern medicine remains unable to treat. It has the potential to achieve positive health outcomes for our population through better control and management of chronic disease. The global naturopathy therapeutic market is projected to expand at a significant pace during the forecast period. In one of the survey conducted in National Center for Complementary and Integrative Health in the United States have reported that around 38% of adults and 12% of children were found using alternative and complementary therapy such as naturopathy for back pain, joint pain, depression, stomach problems, migraine, insomnia, and many more. So let's hear something on role of naturopathy in a global public health. Today, we have with us our guest, Mr. Jon Wardle. I welcome you, sir. Hello, John.
Hello, thank you very much for this introduction.
Yeah. So to speak something about Mr. Jon Wardle, Mr. John is a foundation director of National Center for Naturopathic Medicine and Maurice Blackmore Chair of Naturopathic Medicine at Southern Cross University. In addition to his clinical qualification in nursing and naturopathic medicine, John has postgraduate qualification in public health, law, and health economics, and holds visiting position at Boston University, University of Washington, and University of Oxford. Speaking about his work, John has more than 200 academic publications and works on the editorial board of 8 international academic journals, including editor-in-chief of Advances in Integrative Medicine. John is actively involved in research and policy in public health and integrative medicine. John also serves on the executive of Integrative Medicine Special Interest Group in the Australian and American Public Health Associations, and is a part of Public Health Associations of Australia's Research Advisory Committee. John leads several World Federations of Public Health Association, Pan American Health Organization, and World Health Organization initiative on integrative medicine, and currently serves as a deputy chair of National Health and Medical Research Council on Natural Therapies Advisory Committee. John was one of only 4 official traditional medical representatives at Global Conference on Primary Healthcare and Health to ensure the role of traditional and complementary medicine in achieving global health aims, which was captured in Astana Declaration on Primary Healthcare. John has worked on integrative medicine, traditional health knowledge recognition, public health and primary healthcare policy, and regulatory initiatives with governments, non-government organizations, and international bodies. John is passionate about protecting and embracing traditional knowledge and fostering innovative research, and believes that combining both optimal public health outcome can be achieved. So please welcome Mr. Jon Wardle.
Thank
Over to
you.
you, Mr. Over to you, Mr. John. Take a charge.
Wonderful. Thank you very much for that wonderful introduction. So as stated, I am both a passionate believer and practitioner of naturopathy, as well as a passionate believer in public health, as well as a practitioner of public health. And I firmly believe that there's no clinical profession that understands or can influence public health the same way that naturopathy can. And my living goal is to get naturopaths more involved in public health discussions locally, nationally, and internationally. And hopefully after this presentation, you will see some of that passion and hopefully understand why that passion does exist. So I am going to share my screen. I think there's a slide set that I do have ready for dissemination. And one thing I really do want to, I guess, share with the Indian profession as we go along is, as someone who's visited India quite regularly, I understand Gandhiji's role in the profession and place in the profession in India, but it's a relatively unknown role. It's certainly in Australia and the US, and there is a great deal of interest in exploring the impact of Gandhiji's work in naturopathy in India, and actually learning more about that internationally. I've chosen to not go into his work in a lot of depth, but there are a few quotes I think that really do highlight, I guess, the idea that in many respects, like many of his teachings, he really was a man ahead of his time. And he really did reinforce, I think, the role that naturopathy could play in what public health is now currently trying to do now. So today's presentation, we'll just have a very brief overview of a few things. What is naturopathy? I think I'm preaching to the converted here, but also, how can it actually help? Global developments that are currently in discussion around traditional and complementary and integrative medicine, TCI, as the World Health Organization calls it, which does include naturopathy. And I think naturopathy really is fortunate to really be at the forefront of being able to achieve what the WHO want more than I think any other traditional medicine system. Trends that I think the profession probably needs to examine in some detail to actually help really reinforce its role, and some practical examples and some key takeaways. One thing I also want to just highlight to people is just how interested the public health community are in naturopathy. I'm often asked, whether I consider myself a naturopathic academic or a public health academic, and my answer is usually, they're essentially the same thing. Naturopathy is public health is naturopathy. So I would just like to acknowledge some of the role and interest that the World Federation of Public Health is actually showing in traditional medicine systems, particularly naturopathy, led by these 6 national associations here, Australia, Indonesia, the US, Brazil, South Africa, and China. It would really, really hearten me to see India added to that list. So hopefully after this presentation, if anyone has any links into the Indian Association, they can really, there's a massive role for Indian traditional medicine systems and for Indian naturopathy in particular, which is truly unique and unlike the way that naturopathy is practiced in many other settings internationally, and I think in a way that is actually very important to public health. And there's a lot that the international community could and should be learning from Indian naturopathy. So what is naturopathy? How can it help? Look, I don't want to go too much into this because obviously this is something that most people in this audience do know already. But if you're looking at, the underlying principles, it may not be explicit that these are very, very much linked to what public health is trying to do. So DSERE, for example, is obviously trying to educate the patient. Health literacy is an essential part of what the World Health Organization and multiple public health agencies are trying to do more and more. Prevention, treating the cause, the underlying cause, to actually lead a life of good health, not not just merely treat the symptoms. Tole totem, of course, treating the whole patient. And actually encouraging good health, not just treating disease. If you look at the WHO definition of health, it is, not merely the absence of disease, but optimal mental, physical, emotional, and spiritual health, which is essentially the way that it's encouraging the natural way of the body's order and actually improving that as much as you can. So I think there's a lot of overlap, and look, I think that this has been something that's certainly been in naturopathy since its outset. So you've been studying the historical documents of Gandhiji and Indian naturopathy. I thought I'd put one up of Australian naturopathy for everyone. But again, it's the same thing. It's that these principles have been underpinning naturopathic medicine since day dot. They really are an intrinsic part of it. All the research that we have done of naturopaths in Australia, the US, Europe, Africa, and Asia have repeatedly reinforced the fact that naturopaths aren't just talking the talk; they're really, really walking the walk. They really are a tool for health promotion and improved health in communities in a way that's just completely in line with public health outcomes. And certainly, we've written about it quite a lot, but naturopathic medicine and public health really do have intersecting paradigms. And many of the things that public health is struggling to get conventional medicine to take seriously or to implement are already being implemented by naturopathic medicine in an everyday scenario, at a population level, at an individual patient level, and at a community level. And this, I think, really reinforces a real opportunity for naturopathic medicine, I think, to be at the forefront of improving public health this century. And again, this is something that I did mention before. Gandhiji's work in naturopathy. The thing that I really like about Gandhiji's work is he really consistently reinforces the fact that naturopathy is not a medical cure as such, but a way of life. The Nature Cure Man does not sell a cure to the patient. He teaches him the right way of living in his home, which will not only cure him of his particular ailment, but also save him from falling ill in future. The ordinary doctor is mostly interested in the study of disease, whereas the nature curist is interested more in the study of health. And his real interest begins where the ordinary doctor ends. The eradication of the patient's ailment under nature cure marks only the beginning of a way of life in which there is no room for disease. Therefore, nature cure is a way of life, not just a course of treatment. And I think this is something that was well before its time, obviously. And I've put two definitions, one of SelfCare, which is the World Health Organization's, and one of the Australian Society of Lifestyle Medicine's definition of lifestyle medicine. And I think this is really interesting because these are things that the global public health community are really trying to get people to do more of, and it's something that naturopaths have been doing more of than anyone else. And I think this, really shows that naturopathy was an idea ahead of its time, and the writings of really influential practitioners such as Gandhiji were, again, very much ahead of their time. And I think when we come into things like traditional complementary and integrative medicine, it's really important to remember with medical systems, traditional medical systems, that it's not about lotions, potions, therapies, or other aspects. It's not the medicines or the practices or the individual treatments themselves that are actually important in realizing the potential. It's actually the approach to health. It's the underlying philosophy. It's the underlying principles and practice. And certainly when you look at naturopathy, there's a lot of things, I guess, done in naturopathy's names that arguably are not naturopathic. So, there are a lot of, when we talk about things like the therapeutic hierarchy, there's certainly a need for higher level interventions such as intravenous nutrition, for example. But in many places, North America particularly, it's often the first line of treatment, which is probably inappropriate from a naturopathic perspective. So, actually always going back to that philosophy and that nature cure way of life that Gandhiji recommended, I think is always an important way to recenter ourselves into what naturopathy can do. There's a lot of things that we can take on board that may not necessarily correlate with that, and I think they're the things that tend to be raised by critics as the things that probably aren't that helpful. But there's a lot helpful in naturopathy, and everything that is helpful in naturopathy from a public health perspective is that stuff that is truly aligned to naturopathic philosophy. And again, this isn't an issue related to naturopathy. If you look at complementary medicine, it's a definition of exclusion. It's what medical practitioners don't do, which obviously, if you define it that way, is going to be very difficult. But if you look at the evidence and you look at the, what is actually happening in terms of the global shift of disease, we're moving to more chronic conditions, we're moving to more complex conditions, we're moving to conditions which don't necessarily have a very clear, or if they do have a very clear, they may have multiple underlying etiological or physiological causes. Many of them are lifestyle diseases. Many of them are very, very easily preventable, and many of them are things that, frankly, conventional medicine has not done very well at treating at all. So, and frankly, are things that naturopathy, if you look at the evidence base here on the right of the thing, these are things that the naturopathic treatments actually do have a pretty solid evidence base in treating. particularly the more drugless and non-pharmacological forms of treatment. So, things like chronic pain. We do a lot of work with veterans, for example. In our centre, I've been to a number of conferences in India where naturopathy and yoga is, very incorporated into veteran care in India, but as well as the US, Germany, France. These treatments are quite normal in military and veteran populations because often because the military often understand the importance not just of curing, but actually of optimizing health as well. I'd like to see that as actually being brought into the civilian population a lot more than it has been. Anxiety disorders, obesity, unexplained headaches, mental health disorders, and just quality of life conditions more generally. So, I think we had a quality of life is important, and it's something that's been instilled into naturopathic care from its outset. But listening to the patient can be something that's quite difficult for conventional medicine to do. And a really poignant example I often use is rheumatoid arthritis, where every clinical intervention has been focused on pain, and it wasn't until patients were actually asked what their quality of life issue or their treatment priority was, fatigue and rheumatoid arthritis actually came to the forefront. And I remember as a clinician before this research, focusing on fatigue and rheumatoid arthritis patients was seen as somewhat missing the point, when actually it wasn't missing the point. It was actually getting to the point and meeting the patient where they were. So there's certainly a lot of potential for naturopathy in public health, particularly in the trends that are coming across. And I think one of the important things to remember is there's a place for naturopathy everywhere along that intervention order. So certainly, ideally, drugless lifestyle, non-medical interventions are certainly preferable. But sometimes there are instances where further interventions may be needed, conventional, allopathic, or otherwise. And there's actually a very, very big role for naturopathy there as well, because many of these things are clinically effective, but quite unpleasant or may have side effects. And naturopathy has a incredible role in actually reducing those side effects, or in many cases, actually making those treatments far more effective. We have done a few trials, for example, of naturopathic care post-surgery for cardiac patients that have got to a stage where surgery is now the only option. I know that the National Institute in NIN in India, for example, have done wonderful work, actually, working with HIV patients, taking concurrent conventional care as well. So I think sometimes we think of, well, certainly I know that people in the conventional fields do think of naturopathy as something that, it is okay for prevention or chronic or other conditions. But I do want to just, highlight that there is really a place using that therapeutic order for naturopathy at any stage of that framework. And the world is open to it. Most of you will know this report, the WHO Global Report on Traditional and Complementary Medicine. What you may not know is this meeting where the report was launched, where there are a few of us here, including quite a large naturopathic contingent. So if you look, I'm there, but the executive of the World Naturopathic Federation were there, and there were a few independent naturopathic representatives there as well. But there was actually a whole WHO workshop on how we can actually get traditional medical systems more integrated into health systems, because we're at a stage now where WHO has recognized the importance of a number of traditional medical systems, a number of approaches to health, and naturopathy really is probably one of the most established ones of those. The idea of efficacy, underlying treatments is now done. So now what they're looking at is not just getting countries to recognize it, but actually getting countries to integrate and identifying the best way to integrate these treatments is essentially where the World Health Organization's priorities are now in its second strategy, and its third strategy, which is already under development, will basically be chastising is probably the wrong word, but sort of, you know, pushing countries even further to actually make sure systems like naturopathy are available to those who need them, and trying to take away some of the excuses some countries may use for not integrating. The underlying document from of primary healthcare, and this was mentioned previously, but the Astana Declaration is now replacing the Almirada Declaration as the guiding document for primary healthcare globally. Every UN, not just WHO, but every UN member country actually signed up to it, and it is actually a document sanctioned by the United Nations, not just WHO. There was a traditional medicine statement, which actually was the impetus behind WHO recommending the integration of traditional medicine in various countries and developing that traditional medicine strategy. But it was quite a loose statement. And one thing I really do want to reinforce is that Astana, the updated declaration, did not just replicate or repeat that statement that, you know, people have a right to traditional medicines, but actually went a lot further and actually said traditional knowledge as well as scientific knowledge needed to be incorporated into global health policy. And in terms of health technologies, traditional medicines, and traditional medicines here actually mean traditional medicine practices as well as products. Health technologies has a funny meaning, but it does mean hydrotherapy as much as it means a herbal medicine. You know, needs to be extended in countries. So, you know, it's not just being repeated, it's actually being reinforced. And, you know, if you're looking at the regional level, countries are taking this in a number of ways. So the Western Pacific region, which is the region that Australia is in, that we do a lot of work with, they've actually integrated traditional medicine as an essential element of their framework to action on aging, which I think is a huge boon for naturopathy and yoga and other, as well as other things. But yoga and naturopathy, I think, particularly do very well out of that focus. In Africa, you know, there's a real goal to actually get traditional and complementary medicines even more integrated into health systems than they are. And some countries, South Africa, Zambia, and Ghana, for example, are actually turning to the naturopathic profession to do that, because you know, these are groups that are very well trained, try and avoid unnecessary conventional treatment use, but actually have a ability to actually work in conjunction with other systems to a level far greater than most other TCIM professions. And PAHO has established traditional medicine not just as something that countries ought to do, but has actually instilled it as a human right that countries should do. And if you're looking at, you know, one of the things that I just to highlight the importance of, I guess, naturopathy and yoga at WHO in terms of TCIM's, in terms of TCIM recognition and promotion of the AYUSH professions. There are only currently 2 AYUSH strands that have formal benchmarks and training about to be developed into practice benchmarks, and they are naturopathy and Ayurveda. Yoga is actually being developed separately as well. But, you know, homeopathy, for example, is not receiving the same level of promotion at WHO that naturopathy is. And again, when you're looking at WHO, they're really trying to reinforce naturopathy and other professions, not just to be have an interface, so, you know, be co-located, but actually to have proper integration of naturopathy and yoga and other TCIM services into the health systems. And one other very exciting, I think, development. So most people know that traditional medicine knowledge is being increasingly legally recognized through various frameworks. So for Chinese medicine, which was the first off the rank. These are actually Chinese medicine terms are going to be included into the ICD-11 as a formally recognized set of diagnostic codes. Naturopathy is actually in the next tranche of therapies actually being included. So naturopathic diagnoses will be included in future editions of these documents, which basically define the way that treatment is diagnosed and codified and how health systems are built. So essentially what it means is that naturopathic diagnosis will now be officially recognized to the same extent that conventional medical diagnoses will be. In terms of trends, look, this is just some of our work from Australia. I've done that basically as an Australian guest, but this is extended across India, and globally. But look, why is it important to actually engage with practitioners like naturopaths? Because naturopaths are actually out there. If you look at a region like Africa, and we've been meeting with the WHO Africa's region for our work, in a lot of for a lot of our work, there is one medical doctor for every 20 to 30,000 people in the African subcontinent. There is one traditional medicine practitioner for every 400 people. That is an untapped healthcare resource that countries are increasingly wanting to tap into. And importantly, the community actually has a great deal of trust for the approach and the practitioners involved in this level. And again, we've done a lot of work in rural populations, and there's often been there's an unequivocally strong evidence base showing that patients in rural areas use naturopaths as well as other complementary medicine professionals significantly more than patients in urban areas. There's been a mythology that this is because they didn't have access to, quote unquote, real conventional medicine. But our work shows this to be completely untrue. And actually, people are seeing these therapies. People are seeing naturopaths because they want to, not because they're forced to. And we've, replicated this in areas such as sub-Saharan Africa, for example, where the same myths came across that people, preferred conventional medicine over complementary medicine if it was available, and it's just simply not true. If you do put a conventional or allopathic medical doctor into an area where naturopaths, traditional healers, homeopaths, whoever may be providing care, they will have someone else to refer to, but they'll still be choosing their complementary medicine services as well. And the other thing I just want to, really reinforce is that, again, this is Australian research, just because this is something that I thought I'd bring up just to internationalize the thing, but we've seen the same trends in the US, in Canada. We're just doing the work in South Africa at the moment. Latin America shows all completely the same trends. But there's actually higher traditional and complementary medicine use across. I've got rural populations. I'm sorry, I just did a talk on rural populations previously, but all populations across all age groups. But not only that, there's been another mythology that older patients tend to use traditional medicine more than younger patients, and we're actually seeing this is actually completely the opposite. Use of traditional medicine systems like naturopathy is actually increasing with generations, not decreasing. So, this is something that countries are increasingly being encouraged to integrate because of these sorts of reasons. To give you some examples of what this might look like in practice, and I should let you know all these pictures are sort of related to work that we're doing. The Hypericum basket before is we're doing a project on Hypericum immersion and herpes zoster, which is showing some good results. That was actually from the harvest of that for preparation of the baths. This is actually one of the oldest pharmacies in Australia, which began as a what they call an eclectic pharmacy, and actually now has one of Tasmania is where it's based, in Hobart, one of the state's largest naturopathic outpatient clinics attached to it that we're working with for a number of different conditions, and has quite an unusual model where it's an over-the-counter model where people can actually be advised on lifestyle, self-care, and where necessary, further interventions to actually help under the guidance of a naturopathic practitioner. But in practice, what does this look like? So we've discussed the therapeutic order. So again, I just want to really reinforce that naturopaths don't just have a role in chronic diseases. They don't just have a role in the primary prevention. There is a tertiary and secondary intervention role there as well. And, there is an increasing role because, frankly, of the changing global health priority areas. And in a way, conventional medicine's focus has been on acute and infectious disease for so long that in many ways it's forgotten it's how to do preventive medicine. So naturopaths, again, are an untapped resource that have never forgotten and have been doing this from the start. How is naturopathy integrated into various public health units internationally? So here are a few examples, for example, that are actually employing naturopaths. There's in Victoria, there's a endometriosis hospital and naturopathic clinic, for example, and there's a lot of really promising research and clinical results there on all sorts of things from dietary intervention to physical medicine to one of the things that I always find very interesting is microbiome. There's a lot of microbiome research in endometriosis, and a lot of the research in that has actually been based on naturopathic protocols, often with naturopaths not being fully acknowledged for that, but there has been a historical use of increasingly known to be effective treatments for endometriosis that are non-pharmacological in nature, that do have a naturopathic basis. In Canada, the Canadian College of Naturopathic Medicine has a Ottawa Cancer Centre for Integrative Cancer Care, which is integrated with Ottawa's largest cancer hospital. So it is actually working with a conventional hospital. But it is having really great results with symptomatic. It's reducing side effects, so things like acupuncture for nausea, for example, induced by chemotherapy, as well as clinical care and sort of lifestyle medicines that actually have been reducing recurrence. In Nicaragua, something that's very evident, very important for us to think about now, I think, and I've got a last slide on COVID, which will actually bring this up, but post-infectious disease sequelae for chronic pain. Chikungunya is an infectious disease which has ravaged that country, and the only thing that seems to be working for chronic pain is a nature cure naturopathic protocol delivered by the National Institute, the Instituto in Managua. In Zambia, a number of naturopathic interventions for HIV and alcohol dependence. There are some residential units that are actually getting really good results there. And in the US, even in an unlicensed state in Massachusetts, the nutritional and mental health component of the group medical visits program is delivered naturopathically. It is delivered by a naturopath called Ryan Bradley, who some of you may be familiar with, has developed that program. I think it would be remiss just to not acknowledge the really great work I think that Indian naturopathy inpatient hospitals do, inpatient and outpatient hospitals do. And I can confirm this is a model certainly that we put forward to our university, and we are trying to build here in Australia, because it is a model I think we'll be seeing more of internationally, because it is something that naturopaths globally probably aren't doing enough, but it is something I think that, particularly with things like diabetes, hypertension, these sort of lifestyle diseases, this residential type program, which has a very, very strong education component, is going to be incredibly important to address some of the conditions that we're actually doing. And the work that we've been doing internationally in integrative medicine actually replicates what Indian naturopathy hospitals are doing, and probably just not calling it naturopathy. So this is from a state-sponsored program in Peru called Circular de Salud, which again has inpatient and outpatient lifestyle models, which are very, very much built around health promotion, very community-based, incorporating a lot of naturopathic treatments, although they tend to call it curanderos or integrative medicine in that particular country. One of the other things I think we need to look at is just the self-care aspect as well. And I mentioned before, I showed a WHO has a self-care definition. That actually comes from the self-care agenda. The WHO and national governments are really pushing for an increased role for self-care in all healthcare systems to not just empower patients, but also to reduce overall systems cost. And actually, just last week, I was involved in a launch of a self-care policy blueprint by the Australian government, which we as a national centre were actually very fortunate to be co-authors of. So there is, already a look to the naturopathic profession for helping for this. And I actually did a presentation for the government, and they asked me for an example of a naturopathic intervention that might really be useful for something across the self-care continuum. And it was really interesting listening to Dr. Lakshmi's talk there, because hydrotherapy was actually the one that I mentioned. It's something that can be used very effectively in intensive settings where a practitioner maybe can, required, but it can also go back down that continuum. It's drugless. It's usually involving equipment that most people will have in their homes. It's free, in terms of there's no prescription costs or anything involved with it, and it can actually be incorporated across, from in-person, inpatient hospital settings all the way back to that day-to-day treatment. And again, naturopathy is something using that self-care approach that can be used across primary prevention to secondary or tertiary prevention. And again, here are some examples of that. So, primary prevention can reduce, and these are examples that are actually in the real world already happening with naturopathy. Some of them in India, as well as elsewhere. So primary prevention, reducing the risk of health problems by reducing lifestyle risk or targeting high-risk groups. Lifestyle intervention for promoting cardiovascular health before something has actually occurred. Secondary prevention, where you've got at-risk patients, so yoga for pre-diabetic patients is known to be very effective, or other naturopathic lifestyle interventions. And tertiary prevention, which may prevent or delay disability from long-term conditions. And I've got yoga for cognitive decline here. I truly do think that there's the next big one, I guess, that we're going to be seeing is what they call LongCovered. So looking after COVID survivors, which I'll discuss in a little bit more depth previously. Again, it can reduce the severity and improve the efficacy of other conventional outcomes. So these are two naturopathic programs looking at cardiovascular disease, one which was actually primary in nature, so delivered in Canada with the Canadian Postal Service, one which was actually for post-surgical patients. So, it can improve the immediate post-surgical outcomes, but also have long-term improvement in clinical outcomes, and it can reduce the overall system costs, such as readmissions. Again, cancer care, obviously the preventive interventions that we use as naturopaths are, very, there is a reduced incidence of cancer from all of those interventions we have. But even once patients are being treated for cancer, there's still a lot that naturopathy can do in many circumstances. So, fasting is another one that there's increasing evidence bases for up there as well. And self-care, we've mentioned self-care a few times now. but it is a relatively new area for public health. And I think one of the important things we don't probably acknowledge as a profession in naturopathy is public health is looking for a lot of solutions to implement the kind of things it knows it should be implementing, and it doesn't necessarily realize that naturopaths are already doing this work. I remember we had we've done a couple of studies now of naturopaths in Australia where, we've identified how naturopaths are practicing in Australia. They're doing nutritional, dietary, and lifestyle counselling in every single patient interaction. We're seeing results from that with improved diet and improved lifestyle practices. You compare that to conventional medicine, which is lucky to reach 30%. And when we're presenting that work, we're often our critics will often talk about how, well, this isn't naturopathic care. This is just good medical practice or good public health practice or good practice or whatever. We shouldn't think of this as naturopathic care. Then the naturopathic component to that is naturopaths actually know how to get these changes happening in the real world. And that really is that implementation gap, I think, is where naturopaths really have an extraordinary advantage over other professions, because not only do we know this is good for patients, we also know how to get patients to do it and how to elicit those changes in patients. And I think that's something that we probably don't value enough as a profession, because already public health is telling the public to essentially follow the naturopathic way of health without probably realizing that naturopaths are a good tool to be included in that conversation. And again, one of the things I think that we also need to probably think about, where will naturopaths play in the global health changes? There's obviously, it's a very early time to talk about COVID at the moment, but there is a very real need for an acute focus on the infectious disease phase with ICUs. And look, there is some stuff that naturopathy can do there, but not nowhere near to the extent that we can actually help out in the third wave, second wave, and fourth waves that are actually coming of that. So when we talk about infectious diseases, we always talk about post-infectious sequelae. We're already seeing a lot of data that, people are having unexplained migraines and headaches, unexplained chronic pain, mental fatigue, all these conditions that we know from other infectious diseases such as Ebola, SARS, that naturopathic approaches can be very, very helpful for. And so I think, I think it's another good chance for naturopaths to sort of show that they're ahead of the trend, and reducing those chronic conditions can be quite important as well. So the key takeaway for me is, look, is naturopathy addressing the global disease burden? I would probably say probably not at the moment. And the real key issue for that is lack of integration. And I think there's really, this is certainly where my work in public health comes forward, and trying to remind countries of why naturopaths should be included more and naturopathic approaches should be included more. Could naturopathy address the global disease burden? Definitely. There is definitely a role there. And I think it's, it's something I would encourage any naturopathic practitioner, any naturopathic organization to really highlight what they can do, because most of the time is the reason that naturopaths aren't integrated into healthcare systems, in my experience, has been that many people designing those healthcare systems aren't actually aware of naturopaths. And so I think that awareness issue is something that we need to really try and, reinforce. So there's so much good work happening out there in the naturopathic community. Webinars like this are a wonderful way to actually, reach those audiences to do that, because the more people that know about naturopathy, the better, and the better the health will be more globally. So I've reached my just over 40 minutes now. So I just want to, if there are any questions, or if you have questions that you don't feel like asking immediately, my contact details are up there. I just want to acknowledge some of the groups that actually made our new national centre happen. So obviously the Blackmore Foundation and HMRC have been incredible supporters, and I just want to thank my previous two employers before coming to this thing, because a lot of the work we're currently doing here started at those institutions, Oxford and UTS, and is still involving them very significant. And of course, I want to thank everyone that was able to make this webinar happen. The National Institute of Naturopathy in Pune, the Ministry of AYUSH, obviously, and the Bureau of the Regional Outreach Bureau as well. This is an incredible resource, and I'm going to be linking my students to it.
Thank you so much, John. It was wonderful presentation. What you have covered almost, what is the stakeholders meaning regarding to it, how the naturopathy is being taken care, and how the naturopathy is holding its position in worldwide, going forward in the public health. Yeah, it was wonderful presentation, and it was nice to hear with that. So we're going with the further. Now we'll have a brief session on vitality in Hindi by Dr. Kajal, and the followed will be a question answer session. So I would request Dr. Kajal to present vitality in Hindi.
नमस्कार। जैसा कि हम सब जानते हैं कि इस वर्ष प्राकृतिक चिकित्सा दिवस का विषय प्राकृतिक चिकित्सा के माध्यम से जीवन शक्ति का पोषण है। इसलिए आज मैं आप सबके सामने व्यसनों के बारे में बात करने के लिए उपस्थित हूँ। कैसे व्यसनी पदार्थों का सेवन हमारी जीवन ऊर्जा पर प्रभाव डालता है। व्यसन एक ऐसी स्थिति है जिसका परिणाम तब होता है जब आप किसी पदार्थ का उपयोग करते हैं या अपने आप को किसी भी गतिविधि में करने से आपको खुशी मिलती है। आपका सेवन मजबूरी बन जाता है और यह सेवन आपकी दैनिक जिम्मेदारियों में हस्तक्षेप करना शुरू कर देता है। ऐसा करने से आपका काम और स्वास्थ्य भी बाधित होता है। किसी भी नशीले पदार्थ के सेवन से या किसी भी तीव्र गति में मस्तिष्क से डोपामिन से नाम का हार्मोन निकलता है, जो शरीर की इनाम प्रणाली में से एक है। यह हार्मोन आपको अच्छा महसूस करवाता है। मस्तिष्क उस पदार्थ या अनुभव को महत्वपूर्ण मानकर एक अच्छे अनुभव के रूप में दर्ज कर लेता है। जॉन हैरी ने अपने भाषण में एक बार कहा, लत एक अनुकूलन है, यह आप नहीं है। यह वह पिंजरा है जहां आप रहते हैं। लत किसी भी पदार्थ, व्यवहार, जुआ, खरीदारी, गेमिंग, इंटरनेट, खाने के विकार से हो सकता है। तो अब सवाल यह है कि क्या हमें लत है? क्या हम किसी भी पदार्थ जैसे कैफीन, तंबाकू, ड्रग्स आदि के आदी हैं? यदि हाँ, तो उसका गंभीरता क्या है? क्या वह एक ऊपरी स्तर पर है या वो एक गंभीर रूप धारण कर चुकी है? जब हम स्वास्थ्य पर इस पदार्थ के प्रभाव के बारे में बात करते हैं, तो इसका कोई सकारात्मक प्रभाव नहीं होता, भले ही हमारे मस्तिष्क में इसके कितने भी अच्छे अनुभव दर्ज हों। इसलिए हमें उन नशीले पदार्थों के प्रभाव को दूर करना होगा, क्योंकि यह पदार्थों का सेवन हमारे शरीर की महत्वपूर्ण ऊर्जा का उपयोग करता है। लंबे समय तक इन पदार्थों का उपयोग कई मायनों में जीवन को सीमित करता है। दूसरे शब्दों में, हमें किसी भी व्यवहार, गतिविधि या आदत से सावधान रहना होगा जो जीवन शक्ति को कम करता है, और एक खुशहाल और स्वस्थ जीवन के लिए हमें उन्हें दूर करने की आवश्यकता है। इसलिए मैं अपनी आज की चर्चा का विषय होगा शारीरिक गतिविधि और जीवन ऊर्जा। जानने के लिए हमारे साथ बने रहें। धन्यवाद।
In Hindi. Thank you so much, Dr. Kajal, for us briefing in Hindi about vitality regarding to addiction and other ways. So let's move on to the question answer sessions. There had been a overwhelming response from the viewers who are watching the presentation. We will just go with the quick questions asked by the viewers. So to begin with, here's a question asked by Mr. Kishan Rao. He's been interested to understand, can you elaborate new frontiers in naturopathy and challenges?
On the new frontiers?
Yeah, new.
So I think one of the challenges that naturopathy probably has more than any other traditional medicine system is essentially the challenge of co-option, and that's why I really reinforced that at the start. going back to that principles and the way of life and encouraging, the vis medicatrix natura is really at being the heart of everything that we do, because there is I guess a real trend in many circles to replace naturopathy with what they call natural medicine. And look, some natural medicines work very effectively, some don't work very effectively, but ultimately, the natural medicine has to be used naturopathically at the outset. And in terms of the challenges, I think one of the big challenges I see is just that there is a lot of really good work that naturopaths are doing out there that may not be understood as being naturopathic. So a really good example in Australia is there's a naturopathic hospital, inpatient hospital, called Quest for Life in southern New South Wales, and they've been doing a very effective residential program for bushfire survivors and the PTSD of people who survived the bushfires here in Australia. And they are a naturopathic hospital, but any work that actually praises the results they're getting or the work that they're doing never identifies them as being naturopathic. And I think sometimes that what naturopaths are doing can get lost in the noise unless we actually remind people, well, this is actually naturopathy that's helping. So, and certainly when I talk to WHO, that is the biggest issue we have with integration of naturopathy, is they just, many people in the WHO don't understand what naturopathy is. So we need to do a lot more of that public outreach, I think. So,
Yeah. So that's what is the viewers will be happy to answer. Uh, there is a second question asked by Dr. Henry Salva. She's been keen to understand what is the idea of having a uniform degree curriculum in naturopathy across the world.
Well, this is really interesting because my two clinical backgrounds are nursing and naturopathy. And nursing is probably seen as being quite similar over the world, but there is no uniform degree even in nursing, or in conventional medicine, or in anywhere else. So I do think there needs to be a standard shared minimum, but every country will need to, I guess, adapt that to their own cultural, to their own cultural norms. And one of the reasons for that is, if you look at the naturopathic principles and philosophies, the encouraging the natural order of things is going to be very different in northern Sweden to southern India, for example, or just for things of climate, of the different foods, the different conditions that may need to be treated. And the other, rather than a uniform degree, what I think needs to happen more is people providing those degrees need to be meeting with each other more regularly, because that's what medicine does, conventional medicine does, that's what nursing does, and other traditional medicine systems like chiropractic and things do too, because then it's a free flow of ideas that people can learn from each other. But I think there does need to be a minimum uniform degree that at the very least establishes naturopaths as primary care practitioners, and is enough to do that at a global level.
Okay. So just I would continuation the same question. So as you being in the position of getting communicated with a lot of globally, where you meet a lot of naturopaths, and I just wanted to have and continue the same question. What do you feel, or what you've been at a place where you can see that you are making something in policy in matter of understanding in naturopathy. So what is your role of addition of such kind of an naturopathy subject, something called when the people are learning medicine at the second year, something like when they learn something about community medicine. So what do you understand, or what is your role in taking naturopathy as in adding the subject in something in community medicine?
So actually, if you look at the World Health Organization benchmarks and training in education, there are what they call type 1 and type 2 programs. And type 1 programs are for training someone directly as a naturopath as their first degree, or if it's a undergrad then postgrad as their combined degree. The type 2 program is specifically designed for nurses, allopathic medical practitioners, pharmacists, something to upgrade them enough so that they can actually know enough about naturopathy so that if they are practicing naturopathically, they're not bringing naturopaths, I guess, into disrepute by doing it incorrectly or something like that. But there's definitely a very big role, I think, for teaching people more about naturopathy. And most allopathic practitioners know a little bit of the traditional medicine system. So I think if they're limited to referring and working with naturopaths, that is probably enough. I don't know about India, but one of the issues we have with naturopathy in Australia is there is people who do allopathic medicine and then do no training and then become what they call integrative medical practitioners. And some of them, will actually call themselves naturopaths or claim that they're treating naturopathically. And I think having some kind of minimum training around that, and WHO already has that minimum recommended, is very important. So, because it's a lot of people forget that there's actually quite a lot of naturopathy is about the way that you practice. It's not about what you practice with.
Actually, yeah. I guess that very well explains the more in academic way how it should go with that. So in continuation with this, I have another question more in a clinical background, like as you work in a more in public health. So what do you see the scenario, or what do you see a place of naturopathy, as we know that naturopathy is very well working with the lifestyle diseases and other ways. So what do you see as being from upside? So how does a naturopathy is playing a role in something like an acute medicine or something like in rehabilitative way?
Oh, look, rehabilitation medicine, there is a huge potential there. And I think I mentioned in the, the post-surgical space, we're already doing some projects with cardiac surgical units in Australia. And I know we're doing some work with some projects with oncology units in Australia as well. So I think it's like anything. It's about acknowledging the strengths and the weaknesses and of any system. And, there are sometimes things that we can do to actually make those systems work better in acute settings. So, we know in many infectious disease, for example, that once the infection's actually gone, acute medicine just forgets about it. They're done, the treatment's done, and often that patient has, other symptoms that aren't infectious for weeks, years, potentially. So, we're seeing that with COVID, but you see that in things like TB as well. There's a lot of role for naturopathic treatments in TB in conjunction with those other medicines to make them more effective, to reduce resistance, to, frankly, to actually help the body cope with some of the more unpleasant aspects of those medicines. So, I don't think if you look at the therapeutic hierarchy, there's a place for naturopathy everywhere. Sometimes it's naturopathy alone, and sometimes it's naturopathy in conjunction. And I think it's just finding where that sits best.
Yeah. So we'll take another last question. So it is asked by Mr. Tanmay. So he's been interested in that the naturopathy or naturopathic medicine is a form of alternative medicine that employs an array of pseudoscientific practices branded as natural, non-invasive, or promoting and self-healing. The ideology and methods of naturopathy are based on vitalism and folk medicine rather than evidence-based medicine. So in this area, in this digital era, is there any need for apprehension over the statement? If yes, how do you think the ramification of this digital statement be mitigated, reversed? Something like, as we know, there's a lot of questions have been asking, and people they use it something called as a natural non-invasive. So it just the viewers want to know how this digital era can be somewhere like in blocked and use it only as in more of an evidence base rather than just being a folk medicine.
Yeah. Look, I think vitalism is an interesting concept because it's often misunderstood and misinterpreted, and we've actually got a PhD student who is, I guess, using that vitalism therapy in something that in other, and it comes from digital technology actually, communication science and some other sciences called complexity theory. And basically what she's finding is vitalism is sort of the way that naturopaths have been using complexity theory to understand underlying conditions and causes in a way that many other professions are just starting to figure out now, or starting to know that they should figure out. So, I think sometimes the language has been quite quaint and quite different, but the concepts are often quite sound. And I think what I would like to see is a lot more critical attention, scholarly attention, academic attention by naturopaths into the naturopathic philosophy, codifying that philosophy, because that's how we're really going to, I guess, take naturopathy to that next level and to make it more evidence-based, because a lot of those concepts are actually quite sound and they could be implemented in an evidence-based or a non-evidence-based way. So it's about making sure that we don't lose the soul, but do move forward with the science, if that makes sense.
Yeah. So I guess not last but the least, but a small quick question. So as you be in the both the field, as it's like you work in public health and you also have a background of something on naturopathy. So what is your personal view on something like at the global level? What peoples are being preferring something like they wanted to try first naturopathy and then they go for a medicine, something like, or the peoples are diverting toward more in medicine ways.
Yeah, look, the people want to try something like naturopathy before conventional medicine, but they're often not. That option is not often accessible to them. So, and if you look at something like the therapeutic hierarchy, that's kind of where people actually already want to go for their kind of treatment. So naturopathy is a perfect example of that. One of the reasons why I think naturopathy has to, by definition, work with conventional medicine in a lot of those acute settings is because people perhaps weren't able to see a naturopath when prevention was going to actually stop them from getting there in the first place. So, look, accessibility is a huge issue, and part of that is about outreach, and I think part of that is about naturopaths sort of establishing and identifying the areas where perhaps they should prioritize their promotion or their outreach services, because I've seen a lot of occasions in Australia anyway where practitioners get a very strong interest in practicing in this area, but what the patients really want is that. So, maybe we need to be reaching out to the patients who are using naturopaths to find out more about what they wanted to do to get to that first. But my ultimate goal is that naturopaths will be the first point of call for care, and if other forms of treatment are needed, then they are also available. But I think naturopaths are really, really well equipped to be that first point of care.
Okay, so I would say here it was a well presentation where we have more covered, like you have almost covered everything, views on the different region of the country, different areas of the continent, and your view where the naturopathy is playing as a more of a primary role model. And yeah, it should grow, like as I guess only there is a matter of a gap where the peoples really wanted to undergo for a naturopathy, and we are something in just behind the wall. We just have to cross the door and reach to the people that yes, we are most welcome and you can try for this as in primary level of intervention rather than just jumping to it something called as in taking a medicine. So yes, actually it was a great presentation, Mr. Jon Wardle, and thank you so much all the way coming from Australia, as we are almost at the end of the session. So as we leave here in the great afternoon, I just want to say thank you. We are now at the end of the program. Firstly, thank you, guest of honor, Mr. Jon Wardle, for sharing his views and thoughts on the today's program. So thank you so much, Jon Wardle, for coming all the way and presenting yourself from the Australia. I also thank to the Director of National Institute of Naturopathy for arranging such a thoughtful series of webinars. And last but not the least, the Technical Committee of NIN and Administrative Committee making this best effort for such arrangement. And thank you, all of you, the viewers who are viewed to today's program. So viewers, stay tuned for another session on tomorrow to know more about Gandhi's insights on health. So here we leave here today. So I, Dr. Ajink Pawar, signing off. Thank you one and all, and namaskar. Thank you.
Thank you.